Hello everybody, especially you, the youth of the Global Health family, and also the leadership of Global Health Corp, especially Barbara and Katie. Today I am addressing you at the beginning of your initiation training, and I'm so pleased to do so. I would have liked to be with you, but it's not possible. And thanks to the technology to be able to address you through an iPhone. And why I feel that it's important to address you is because I have seen what has been done with those who have been there in your position year after year. I found it so touching and so fantastic. Thanks again to Barbara to have fight to make it happen. For those who have come in Rwanda and those who will come in Rwanda, you will see, and they have seen, that in Rwanda, health is a pillar of our development. Health is taken as a human right, a very simple, nobody talk about it, but each and every worker across the health sector, in a horizontal way or vertical way, is working to make health an accessible right for each and everyone, an affordable right for each and everyone, and a right that can be exercised with quality and in the quantity needed. With those principles that are in fact written in our Constitution: access to health, health is a human right, equity through geography, gender, and age, the participatory process, never do anything for a group, a constituency, the population, the community, without involving them in what you plan to do for them, and going in using the consensus. All this has made our health sector something that we are proud of, because really we have break so many obstacles. Not that we are richer than before. You will see for those who never been here and who are coming. But just because we have taken out of each and every opportunity the maximum for the good of our people. And with that, we have decreased the mortality due to HIV to 78%. We have decreased malaria mortality by 76%. All this between 2000 and 2010 for HIV mortality, and between 2005 and 2011 for malaria mortality. The use of primary care has increased drastically because we have break the geographic barrier. With this principle I have talked to you, geographic equity. We have managed to divide the country by province. We have 5 provinces. By district, we have 30 districts. By sector, in each district. Each sector has a health center. Remain only 10 where we have to build one. Each district have at least a hospital called a district hospital. Some belong to the government, others belong to NGOs, and others belong to churches, Catholic, Anglican, Protestant, whatever. All those hospitals, for those who are belonging to the government, it's okay. It's public service like usual. Others belonging to churches and to NGOs, we have a memorandum of understanding with them as an independent entity. The hospital belongs to them, but we sign that we give them the same benefit has the public service, and in exchange, they give to our population exactly the same care with the same protocol and the same benefit to our population. And for us, it's a good deal. You know about PPP, Public-Private Partnership. In Rwanda, we have invented the PPCP, Public-Private Community Partnership. Meaning, as 40% of the health facilities belong to NGOs or churches, using those networks and building public hospital where there is no access to hospital, we have managed to cover the country in an harmonized and uniform manner. That's what I was talking about, geographic barrier down and geographic equity between the north, the south, the east and the west and the central of Rwanda. Same access, same hospital. Of course, there are some areas of the country that remain hard because it's very high, the roads are not good, but at least there is an hospital there. The second, equity based on age. We have made a great effort to tackle diseases linked to death of children and death of women around pregnancy. You know that this has and still is a nightmare in Rwanda because we still believe that we can do better. Even though we have reduced by more than 50% the death of under 5 and the maternal death, still each and every death is unacceptable. We are fighting against that. For children, we have availed and fundraised for vaccination. Our kids are vaccinated for against 10 diseases. The ordinary vaccine for recommended by WHO, plus rotavirus, pneumococcal, HPV vaccine, Haemophilus, plus contain infectious diseases. I told you the rate of death has drastically declined for malaria, HIV. When we contain HIV, you contain TB as well. But when you have vaccination against pneumococcal, you contain pneumonia. When you have access to vaccination against rotavirus, you tackle more than 44%, 45% of severe diarrhea that are killing our children. Meaning, we have raised the health of under 5 and drastically decreased the mortality of under 5. For the woman, by giving access, giving an equal access based on geography, providing the country with ambulances, training health professionals on for emergency linked to obstetric and delivery and also antenatal care, sensitizing the woman, their husband, and the entire family and community for women to attend for antenatal clinics. We have decreased the mortality in health facilities and also in community level around pregnancy. In 2010, we had 70% of our women that deliver in health facilities, coming for around 10 years ago. So this has improved the life and the health of our women. But on the other hand, we have started what we call the maternal death audit. When a woman dies in a hospital, we do a scientific audit. What happened? Scientifically, what we miss, what should have we done? But when the woman dies in community or on her way to the health facilities, we ask the same question at community level. What happened? She had pain. She lost blood. She asked something that we didn't give, etc. By doing so, we have made the community and the health professional reflecting on why women were dying. And it has improved drastically the service provided to the woman in health facility, but also the attention given to the health and the wealth of a woman pregnant at community level. It has decreased drastically the rate of death of women around pregnancy and delivery. But there is something else. I talked to you about hospital. We have the referral hospital in cities. We have the district hospital in district, health facilities in health center. But in the community, we have community health workers. In each village now, and a village is 100 to 200 houses, we have 3 community health workers. One woman called maternal assistant to care only of the pregnant woman of the village, 100 to 200 houses, and just after delivery, and the child below 1. This gives support to the woman and the newborn. The community health workers are not health professionals. They are people trusted in their village and with skilled enough to be trained in around 6 weeks by the Ministry of Health on health, what are the major problems of health problem in their village, their community, and they treat according to the syndrome. You cough, you have fever, you doesn't have malaria, they give you an antibiotic, a simple one. You didn't improve after 24 hours, they refer you to the hospital. Meaning, they test malaria. If you have malaria, they treat malaria. If you have pneumonia or bronchitis, they give you an antibiotic. But if you have diarrhea, they treat your diarrhea. And they push you to use the services, antenatal clinic, and delivery in the health hospital, and also testing HIV. That's how we have increased drastically the delivery that occur in health hospital, in health facilities, and also the access to treatment for those who are HIV positive, and the test of the family for those who are HIV positive and are married. We have more than 95% of our women that access the test during pregnancy, and among them, more than 90% of men who test HIV at the occasion of the test of their wife. When they are found positive, of course, the children are tested. Meaning, in many countries, women are in bad situation when she is HIV positive. She is segregated, stigmatized. But in Rwanda, due to the fact that, for the time being, all Rwandans have access to IVs, woman is an opportunity for families that are HIV positive because she is an entry point to diagnose and treatment. It has given to the women that are HIV positive another face to their families and to their communities. So this is what happened at community level, at health facilities and in hospital. And due to that, we have increased drastically the life expectancy from around 30 when I came back in Rwanda, 1996, to today, 55. And as we want to continue, and you'll be part of that during at least 1 year, for those who will come here, you will be part of that effort. And because it's something we have done in partnership. The Rwandan communities, the Rwandan health professionals, the Rwandan local leaders, and the Rwandan leaders in the capital, and the development partners, and the young people like you. All of us, we have worked hard. Now we have a life expectancy of 55 years, and we are going to work hard because we are committed to reach a life expectancy of 66 years for the year 2020, because it is our vision, and I'm sure with the work of all of us, we will get there. The other things that we are doing, and we are basing our work on science. All our policies are evidence-based. And I please, as minister, every time that I bring a policy to cabinet, the question is, what are the evidence that make you proposing a new policy? What change it will bring to the people? This is the second question, because we are not rich, and our richest is our people. Everything we do, we are requested to explain which positive change it will bring to the life of Rwandan. And this is very important, because we are individual promotion and wealth driven. By promoting the health and the wealth of each and every individual, we are promoting the health and the wealth of a population. And you know the link it has with economy. Everything targets economic growth, because if we want to sustain one day the effort we are doing, the health we are providing, the drugs, the consumable, everything we have now through global solidarity. If we want to produce them or to buy them by our own, we need economic growth. Economic growth can only occur with a healthy population. So, I talked to you about the participatory process. That's the way we are doing our policies. We identify the need with the population, the people that will benefit, with the people that will implement, and with the people that will monitor it. And of course, all the partners along that chain. The participation process is key. The consensus, meaning we discuss up to the time we agree on what has to be done for our population. The science, the evidence-based, and of course it has to suit to the budget we have, and it has to be aligned with our Vision 2020 and what we call our economic development and fight against poverty strategy. Health is just a piece of all that. We have other sectors, education sectors, agriculture sectors, industry, the industry, etc. Justice. All the sectors have the same principle. All are based on the Vision 2020, the ADPRS. And doing so, the plan that I have in the health sector is totally in synergy with the plan we have in education, with the plan we have for the justice sector. And it allows us to build on what the others are doing and to go very quickly in our development. But we still have a long way to go. if we continue to apply those principles, we will reach there. And now I would like to talk to your role, your common role in the country where we are going. You will go. Of course, you are part of the Global Health Corps, meaning you'll go across the world, in Rwanda, in other African countries, in the US. But whatever place you are, never forget you are leaders. You are young leaders. Young meaning with a full of energy. You can work, you can have sleepless nights, you are a lot of ideas and enthusiasm. Let your heart and your brain talk for you. Whatever place you go, try not to be or to go with the people that are like you. Go to the people that are different. Go to the people you came to serve. Learn from them with humility, with simplicity. Never believe that you have the solution. I am maybe 3 times your age. I still don't have the solution. I'm still learning. And I'm so happy because the day I have nothing to learn, my brain will be dead. So, open your heart and open your brain and learn from those people you are going to help. You bring them a support in their journey for development. They can bring to you something that is life-changing. So be near them. And use your twins to do so. Because your twins will learn a lot through you. Because you are educated in so different way that if each and every one of you among you take what is positive from the other, can you imagine how rich you will be after 1 year? But if you, just because you fail, or you are too lazy to go for change, you just go through near the people that have the same education than you, you will not take the maximum from this experience. And the life will maybe not give you twice that chance. So take this opportunity and learn. I know nobody that cannot teach you something. So take this opportunity. And also, bring your skills where you go. Many of you will go in different areas, some in administration, some in health management, some in health services, whatever. Even in administration, if you do good, you will improve life. So do it with all your heart, all your potential, all your strength. And always take time, again with simplicity and humility, to teach others. Always also think that by teaching, you learn a lot. So, be a good listener with humility. Question yourself. Always believe that you don't have the solution, and the solution is what comes from the work you do together and the reflection you do together. And always think that what seems the solution for you may be something different for the person who is with you. That's my guidance for your participation, and I know that you have been chosen because you have the skills, because you have the heart, because you have the brain to do that. So, all my best for the coming year, and I'm sure that it's going to be something you will never forget. will change your life for better. See you soon for those who are coming in Rwanda.